Your 2-year-old isn't talking yet, and you're lying awake at 2 a.m. Googling autism symptoms. Sound familiar? Here's what I wish every parent knew. Speech delay and autism can look similar, but they're not the same thing. And today, I'm going to show you the 5 critical differences that could change everything about how you help your child. I'm Dr. Sarah, and over the past 15 years working with hundreds of families in developmental pediatrics, I've seen the panic that comes when a child isn't meeting speech milestones. Just last week, a mother named Sarah came into my office absolutely convinced her son had autism because he wasn't talking at 24 months. But here's the thing, by the end of our assessment, we discovered he had a simple speech delay that could be addressed with targeted therapy. This confusion happens because there is overlap, but understanding the differences? That's your superpower as a parent. So let's break this down together, scientifically but simply, so you can move forward with confidence instead of fear. And before we dive in, drop a comment below. Is your child currently experiencing speech delays? You're not alone in this journey. Difference number 1, the eye contact and social connection test. Here's what most parents get wrong. They think if their child makes any eye contact, autism is off the table. But it's way more nuanced than that. Let me tell you about 2 children I saw last month, both 26 months old, both nonverbal. Tommy, who had a speech delay, would look at his mother's face when she called his name. He'd smile when she smiled. He'd bring her toys to share his excitement. He wasn't talking, but he was connecting. Then there's Emma, who would glance at faces briefly, but seemed more interested in lining up her toy cars perfectly. When her parents got excited about something, she didn't look to see what they were looking at. That's called joint attention, and it's huge. The science. A 2023 study in the Journal of Child Psychology found that children with autism show reduced joint attention in 80% of cases, while children with isolated speech delays maintained typical joint attention patterns. This means kids with speech delays usually want to communicate, they're just struggling with the words. They point, gesture, use eye contact to bridge that gap. Actionable step. Try this at home. Point to something exciting across the room and say, "Look." Does your child follow your gaze and share that moment with you? If yes, that's a really positive sign for social development, regardless of speech. But wait, there's a catch to this that most pediatricians don't tell you. Stay with me. Difference number 2, how they play reveals everything. I remember watching a little boy named Marcus in my office. He was 30 months, barely saying 5 words. His father was terrified. But then I watched Marcus play. He grabbed a toy phone, held it to his ear, and pretended to talk. He fed his teddy bear with a toy spoon. He was engaging in what we call pretend play. Compare that to repetitive behaviors I often see with autism. Spinning wheels on toy cars over and over, lining objects up obsessively, or fixating on one specific part of a toy rather than playing with it functionally. The science. Research from the University of Washington's Autism Center shows that 85% of children with autism spectrum disorder show restricted, repetitive play patterns by age 2, while children with speech delays typically show age-appropriate imaginative play. Actionable step. Sit down with your child and introduce new ways to play with their favorite toy. Do they accept your ideas and build on them? Or do they become distressed when you interrupt their specific routine? Document this. It's valuable information for any specialist you might see. What kind of play does your child enjoy most? Drop it in the comments. I read every single one, and your story might help another parent. Difference number 3, the name-calling test that changes everything. Here's a simple but powerful observation. Call your child's name from behind them when they're engaged in something they enjoy. Children with speech delays typically respond within 2 to 3 calls. They turn around, acknowledge you, even if they don't use words. A 2022 study published in Pediatrics found that 90% of children with isolated speech delays consistently respond to their name by 18 months. But here's what I see with many autistic children. They might not respond even after multiple attempts, not because they can't hear. Hearing tests usually come back normal, but because the social importance of their name hasn't registered the same way. Real example. I worked with twins last year, identical twin boys. One had a speech delay, one was diagnosed with autism. When mom called Liam, the boy with speech delay would stop and look. When she called Noah, he'd continue playing as if he hadn't heard anything, even though his hearing was perfect. Actionable step. Test this in natural settings, not when your child is upset or overstimulated. Do it 3 to 5 times over a few days. If they're not responding, book an assessment. Whether it's autism or a hearing issue, early intervention is everything. Now, number 4 is the one that trips up even experienced doctors. Difference number 4, how they handle communication frustration. This is subtle, but so telling. When children with speech delays can't communicate what they want, they typically show frustration toward you. They might pull your hand, grunt, cry while looking at you, trying desperately to make you understand. Children with autism are more likely to have meltdowns that seem disconnected from getting you to help them. They might bang their head, spin in circles, or seem to retreat into themselves rather than seeking your assistance. The science. A groundbreaking 2024 study from UCLA's Center for Autism Research found that children with speech delays use 3 to 4 times more compensatory gestures, pointing, pulling, nodding, than their autistic peers when they can't verbally communicate. Actionable step. When your child gets frustrated, watch where their attention goes. Are they looking at you for help? Bringing you things? That's social problem solving, even without words, is an incredibly positive indicator. Difference number 5, the pattern of delays. This is the big one. Speech delays usually exist in isolation. Your child might not be talking, but they're meeting other milestones, walking, feeding themselves, showing emotions appropriately, playing with peers. Autism, on the other hand, typically involves multiple developmental areas. There might be sensory sensitivities, hating certain textures or sounds, motor issues, difficulty with transitions, or unusual responses to the environment. Real story. Jessica brought in her son convinced he had autism. But when we looked at the whole picture, he was only delayed in expressive language. Everything else? Right on track. 6 months of speech therapy, and he was catching up beautifully. Actionable step. Make a list of all developmental areas. Gross motor, fine motor, social, emotional, self-help skills, and speech. If speech is the only area that's behind, that's meaningful information. Here's what you need to do right now. First, breathe. Whether it's autism or speech delay, early intervention transforms outcomes. The brain is incredibly plastic in these early years. Step 1, schedule a developmental screening with your pediatrician. Don't wait for the 3-year checkup if you have concerns now. Step 2, request a speech therapy evaluation and an autism screening. Get both. Information is power. Step 3, start implementing communication strategies at home. Narrate everything you do. Get down to your child's eye level, reduce background noise, use simple language, and follow their lead in play. Step 4, connect with other parents. Whether it's a speech delay support group or an autism family network, you don't have to figure this out alone. Let's recap those 5 critical differences. 1, joint attention and social connection patterns. 2, play behaviors and flexibility. 3, responding to their name consistently. 4, how they communicate frustration. 5, whether delays are isolated or across multiple areas. Remember Sarah, that mom I mentioned at the beginning? She left my office not with a scary diagnosis, but with a clear action plan. Her son is now thriving in speech therapy, speaking in sentences, and she wishes she hadn't spent 6 months paralyzed by fear instead of seeking answers. You deserve that same clarity. If this video helped calm your worries or gave you action steps, smash that like button and subscribe. I post new child development content every week that could be the resource you need next. And here's my question for you. What's one developmental milestone you're celebrating with your child right now, big or small? Drop it in the comments below. Let's shift from fear to celebrating the wins, no matter how small. Finally, share this video with any parent who needs it. You might be the reason someone else gets their child the help they need sooner. Until next time, trust your instincts, seek professional guidance, and remember, you're doing an amazing job. Your child is lucky to have an advocate like you.